So enter me as a physician level advocate. And I have some examples of what I do and how it can be impactful. So translating complex medical information for families. So an example would be employee Mike gets some lab work done the day before, and that morning before he goes to work, he goes on his portal, looks at his labs, and notices 2 labs that say in red letters with a red exclamation point, abnormal. Is that bad? I mean, the exclamation point and the red lettering would sure suggest that's not good. So he worries and he's distracted. He goes to work and he calls and leaves a message, the nurse will call him back. But he works all day worried about that red letter abnormal test. And then at lunch, he gets his cell phone out, missed the call, talks to his fellow colleagues, what do you think this is? There's 40 different opinions. Again, he's worried. Misses the call again because he can't have his cell phone when he's working. End of the day, the office is closed, and he goes home and worries again. And then thinks, gosh, maybe I should just take a half a day tomorrow off so I can call and be there and present when the doctor calls me back. So, as a resource for them, employee Mike could pick up the phone, call me, and say, do you mind going in my portal and looking at this? I don't even know what these letters, that acronym means. What does this mean? Is this serious? And should I get this addressed sooner than later? That way, that worry is gone and he can remain focused in his workday. Coordinating care between providers and specialists. So an example would be employee Julie. Her mom lives with her elderly mom. She takes care of her. And the day before, the doctor started her mom on a new medicine. And right before Julie went to work, she noticed her mom was a little drowsy, a little confused. She remembers the doctor saying this might be a side effect, but not sure. So she gets on the phone and calls, leaves a message. We'll get a call back. Again, she misses the call. And so all day she's doing this back and forth, trying to return calls and worried about her mom who's at home. So that night, she's still worried, and she decides, I'm just gonna take tomorrow off from work. I'll deal with this, I'll call the doctor, get this addressed, so I don't have to be at work distracted by my mom. As an advocate, I can take that burden on. Julie can call me and say, I'm really worried about this, these are my questions. And I say, I'll take care of it. I'll call, I'll wait for the phone call back. I'll ask the questions and then tell Julie what the doctor said for advice. And that eliminates all that worry that Julie has and the time off she may have taken to deal with this away.